Hey guys, what's up? Hope you're all doing well. So let's start our today's video without any delay.
Click on Zombie Apocalypse.
Today, let's discuss about the breech presentation. When the buttocks, foot or feet of the fetus enter the pelvis instead of the head, it is known as breech presentation. It is of three types: frank breech, complete breech and the footling breech. Frank breech. It occurs in 60% of cases. In this, the legs and the knees are extended while the hips are flexed. It is more common in primigravida. Complete breech. It occurs in 10% of cases. Here, the thighs are flexed at the hips and the legs are flexed at the knees. The presenting part consists of two buttocks, external genitalia and the feet. It is more common in multipara. Footling presentation. It occurs in 30% of cases. Here, the hip and knees are extended on one or both sides. Here, the presenting part may be one or both the feet. Predisposing factors include prematurity, low birth weight, placenta previa. It is a condition where the placenta is formed, obstructing the cervix, which is an outlet for delivery. Uterine anomalies like septate and fibroid uterus. Polyhydramnios, that is increased amniotic fluid levels. Oligohydramnios, that is decreased amniotic fluid levels. Amniotic fluid is a protective liquid which surrounds the fetus. It gives the cushioning effect to the growing fetus and also serve to facilitate the exchange of nutrients and other biochemical products between mother and the fetus. Multiple pregnancies. Fetal anomalies like hydrocephalus, anencephaly, and chromosomal abnormalities. And other factors like previous breech delivery and a grand multipara, that is a woman having more than 5 children. Complications of breech presentation. Increased perinatal morbidity and mortality due to difficulty during delivery. Prolapsed cord and long-term health problems due to birth hypoxia and injury. Increased LSCS rate, which increases maternal morbidity. Diagnosis can be done by per-abdominal examination to know the fundal and pelvic grips and location of fetal heart sounds, per vaginal examination, and USG to confirm the diagnosis. The lady should be counseled regarding the complications of vaginal breech delivery and let her decide about the mode of delivery. Antenatal management includes external cephalic version. It is an outpatient procedure done to correct the lie of fetal position from breech presentation to the cephalic presentation. The ideal time for this procedure is from 37 weeks to the term. Arrangements should be made before starting the procedure for emergency normal vaginal birth or LSCS. Before starting the procedure, an ultrasound is done to look for a normal baby in breech presentation and normal amniotic fluid volume. At first, the breech is disengaged from the pelvic cavity and the two poles of the fetus are determined. Place your hands one on each pole by applying gentle pressure with the thumb on the side of breech. The baby is turned in the direction in which it is looking, known as forward somersault. The force applied should be gentle and intermittent and not for more than 5 minutes. After achieving a transverse position, both the hands are exchanged to make a comfortable version. After the version, the head is grasped and brought into the pelvic inlet. The force applied by the other hand fixes the fetus in the pelvic cavity. Ultrasound is done to confirm the success. Contraindications of external cephalic version are preterm multiple pregnancy, third trimester bleeding, intrauterine growth retardation, oligohydramnion, previous uterine scar, non-reassuring fetal monitoring patterns. Complications of ECV are placental abruption, uterine rupture, amniotic fluid embolism, feto-maternal hemorrhage, isoimmunization, preterm labor, fetal distress and fetal death. Coming on to vaginal breech birth. The contraindications for vaginal breech birth like placenta previa, compromised fetal condition, inadequate pelvis, footling breech presentation, large baby, growth restricted baby, hyperextended fetal neck in labor. Previous cesarean section should be ruled out. Types of breech deliveries: spontaneous spontaneous breech delivery without any traction or manipulation other than support of the infant. Partial breech extraction. The infant is delivered spontaneously as far as the umbilicus, but the rest of the body is extracted or delivered with operated traction and assisted maneuvers. Total breech extraction. The entire body of the infant is extracted by the obstetrician. This is how a breech presentation is managed based on its condition. But this is not the way to correct the breech presentation. Hope you all like this video. Please do like, share and subscribe if you find this information. And don't forget to follow my Insta page for daily case scenarios. See you in the next video.